Hello, I'm Brian Scherff, physical therapist, and I've spent the last 11 years developing the multiple applications treatment table here in Michigan, United States. This table is now being sold. Over the last 2 years it started selling and made in Michigan, made in the USA. I have been using these functions and this table with about 8 different prototypes with real patients over the last 5 years to make a product that is very specific and very useful to physical therapists. Not something that will be purchased and stored in the closet, but something that does everything the therapist would want and more in general. One table, one product that does at least 5 things. It's a treatment table. It is a exercise machine. It is a traction table. It's a tilt table. It is a pulley system. It can be used as an inversion table. It tilts -15 and +45 when it's doing exercises or as a table. And that enables up to 88% body weight. So as a table, it has removable rails. Simply pop right on and off. It has 3 different braking systems. The first to enable the patient to get on without the table moving, the second to control the exercise, and the third welded underneath to prevent the sliding mechanism from sliding away or going into a position that could jeopardize safety. So 3 braking systems, which is unique. Other products such as the Total Gym only have a flexion stop. They don't have any other braking systems. So compared to the Moveo or the Total Gym or any other device, this is focused on safety. So as a treatment table, come on down, patient number 1. You can do a lot of different things. Let me have you do something we haven't done. This is not rehearsed as far as that goes. So I'm going to have you actually lay on your stomach with your head right. I'm going to take your glasses. Right in that opening right there. Yep. Very good. So as a treatment table, you can do a variety of things, any exercises you can think of. The table tilts far enough that this person would slide right off of here in -15 this way. But with this cradle here, go ahead and slide down this way till your feet are at the edge there. You can actually adjust somebody right where you want them. Sometimes a person with back pain, even just their toes up will bother them. So little things like that are able to be done as a treatment table here with this table. The other thing is, do you mind if I manipulate you?
Sure.
Is you can actually provide a little traction with some of the mobilizations with the use of the incline. This is the negative incline, and I'll go all the way just so you see. It goes -15, and -15, you feel it now, don't you?
Mm-hmm.
And you feel maybe like you're sliding off.
A little bit.
Yeah, and I can let go and you're not, but that does provide some spinal traction. Going back up a little bit. Generally, I will only go down, say, about 7 degrees if I want to provide traction with some AP mobs. And ready?
Mm-hmm.
Provides a very nice neck neutral position for even all sorts of manipulations. Whether you're into Keltenborn, Maitland, McKinsey, I've done them all on this table. All right, so now go ahead and sit back up for me, please. And let me have you lay with your head here.
On my stomach or my back?
Let's go on your back this time. Because now we're going to convert it from a table to an exercise machine. And you can do bed mobility facilitated or resisted based on the inclination. An example of that would be, go ahead in a moment, even at only -4 or 5 degrees, and there's an inclinometer here to tell. Try scooting this way just a little bit. You can tell how much easier that is without sliding off, when it is on an even slight incline. And if you have a heavier patient who's, say, been sweating or, as things go in therapy, the greater incline can definitely facilitate the bed mobility. And or if someone is not feeling good, it gives you that Trendelenburg position. So it converts into an exercise table very easily. You simply lift it, and it locks right in place. Lift that leg. I'm used to lifting the person's leg because most of the patients I see can't really lift their leg, at least in outpatient. Then you simply take this brake off. If you zoom in just for a minute, this is the brake right here that would maneuver the table. And then we'll go down and get your feet, slide right down. Put your feet right there and there. Then you go up to your desired inclination. The foot plate is able to go into dorsiflexion and plantar flexion both dynamically, go ahead toes up and down, and statically, and go ahead toes down. You can put it in any position you want. At 45 degrees, it is 88% body weight. Go ahead and try a few squats here. Yeah. You can control the amount of knee flexion with this knee flexion stop. Now go ahead and bend your knees. Yeah. And if the patient, this makes it so you can hardly bend your knees in case they're not feeling good. If a person starts passing out, you have an emergency braking system here. Go ahead and bend your knees a little bit. That will automatically lock in place, enabling you to easily control the patient and start lowering them back down. Now, in tilt table functions, we also have some safety features that are normal to tilt tables. We have a knee strap and we have a thoracic strap. The thoracic strap, generally speaking, has to be put on, unless you have a very mobile patient, before the person gets on the table. And the knee strap I will demonstrate. I'm going to take the brake back off. You can go ahead and straighten your knees out for me. Now I'm going to put the brake back on just to demonstrate. Perhaps you don't like, that you're up this high. Go ahead and bend your knees a little bit. Now try to scoot down just a little bit so you can adjust a person, and that's good enough. And then I'm going to take the brake back off. And you can commence exercising with the brake here, and you can do a similar function with the brake there. So let me have you straighten your knees. Let's say you're worried about the person passing out. We have the knee strap, which can be put on. Now, generally speaking, I will use a few bolsters when doing this. The knee strap can be left on. This is an actual sit-to-stand strap that's been converted to use for the tilt table function. And the Velcro will hold 500 pounds. Then you can go up. Generally speaking, again, I would have a bolster or 3 pillows under the knees to make a very dynamic, stable position. Though to stop a patient from buckling, it's not needed. The other thing I will do when standing is tighten up the flexion stop here. Now go ahead and try to bend your knees. It's very controlled in multiple ways. And the patient, even with this one strap, is not going to be able, even if they completely pass out, to fall. Especially because as a tilt table, it goes up to 45 degrees, not the traditional 80 or 90. And at 45 degrees, it is 88% of a patient's body weight. So that additional 45 degrees only accounts for another 12% of body weight. So when you consider orthostatic hypotension, the effectiveness of what you see here at 45 degrees is very similar to a full tilt table, but without the risks and without the patient being scared. And for vestibular input, you can put several pillows here and get the head oriented, or I often will use a wedge to be in line with gravity. And so for your vestibular input and for orthostatic hypotension, I would argue this is as good as a tilt table. Go ahead and straighten your knees. At least as a tilt table, it's as good as a tilt table. It's much better than a tilt table because after doing standing tilt table functions without getting off of this table, you can release the knee strap. And usually I would do that when the patient is a little bit less standing. And try to bend your knees. You can't because the flexion stop is here. So I can start just now. Go ahead and bend your knees. Some exercise after the standing activities, and gradually add or subtract from the knee flexion. Good. As the patient tolerates with this strap here as well. There is a thoracic strap that I said that I will lower you back down, and we'll go ahead and bend your knees just a little bit. Now the table is locked. You can put your feet down and the person's not going to go anywhere. They're going to feel more secure. You can actually convert this exercise machine as it is now into the table, even with the patient on, simply by bringing these down. Thank you. And then if the patient has suffered a brain injury or is ataxic due to a stroke or other neurological condition, in dealing with those patients, they're going to be all over. You give them a nice, easy surface to stand up from. Go ahead and sit right up at the table, but don't get up yet, because there's more. Because of the tiltability, which again is a unique feature of this table that other tables do not have, if a person has a lean due to neurological conditions such as a stroke, you can work on this either dynamically or statically by doing activity, and this will promote a lean in the opposite direction of whichever way you tilt it, and you can go to pretty challenging levels at negative 15 degrees. Even for a normal person, it's going to throw you off a little bit, correct? Mm-hmm. Yeah. And again, my model here has not experienced any of this, so it is a new experience. And this is a one take, so. You can go the other direction. And this, I can go all the way to 45 degrees, which I will not do because you will slide off the table. So, the thoracic belt, which I was talking about, is another way to control the patient if you're worried that they're going to have some trouble. It's a brand new one, so the Velcro is really working. It simply slips on here, and then go ahead and, normally I'd have a pillow here. Go ahead and lay right down. Then this will attach there, and then you can do the whole thing. Again, this keeps the patient very securely, even without the knee strap, from going anywhere down in that direction. I'll take this out. All right, thank you very much. So this actually doubles as the traction belt. And when it's used as the traction belt, it actually attaches on this side, and the patient's head is here. The traction assist device is here, whether it's a motor or whether it's the pulley system that comes with the table. And that allows a person to do self-traction. The therapist can do traction, and I won't set that up because of time of it. There are other videos that have that. But this belt has a bit of a multi-purpose with that in mind. Also, the arm exercises are utilized by the pulley system, which are addressed in other videos. But this fairly thoroughly will go over the main functions most people want to do in rehab, acute rehab, neurological rehab, stroke rehab, brain injury. These are the main functions. They don't generally do a lot of traction. The pulley systems get used, but what we've covered is what 95% of the therapists want to see. And some of this is non-existent in any other product but this table, especially the ability to do dorsiflexion, plantar flexion dynamically. Statically does exist in things like the Moveo, but they cannot do it dynamically. The fact that it negatively tilts is a unique feature of this table that you cannot find right now other than the mat table. Thank you very much.